Heart University and Dr. Scott on AM 970, The Apple.
Welcome back on your Smarter Heart University. Answer to our first pop quiz that several studies over the past 20 years have shown either a 20, 30, or 40% reduction in dying from heart disease in high-risk patients or patients who already have heart disease. Well, dietary supplementation with fish oil, also known as omega-3 fatty acids, taken for at least 1 year or longer, significantly reduces the risk of cardiovascular death, cardiac arrest, or dying from any cause in up to 40%. The benefit seems to be risk dependent, and that's the most important take-home point, number one for all you out there. The higher your risk, and I'm going to say it a couple times, the better your benefit with fish oil. That's what it seems to be. Omega-3 fatty acids have really several beneficial cardiovascular properties. Anti-clotting, anti-rhythm improvements, as we talked about, anti-inflammatory, anti-hypertensive, cholesterol lowering. So therefore, that protective effect, Dr. Kaiser and I were talking about this on the way over here, may be due to a number of these things collectively. They're just not sure. We really don't have any final say on this. By aiding the healing of your artery lining, keeping the clotting factors from clumping together, the omega-3 fatty acids, as I stated earlier, are the angelic form of the fatty acids, opposite of that of the evil, deleterious omega-6 competitors. The threes are so vital to so many activities inside your cell, at the cholesterol level, actually keeping the cell membrane, the cell intact, if you will, and at the electrolyte level, that governing your heart rhythm, the omega-3 fatty acids, that I could spend hours talking about it. So let's look at a couple of the cardiovascular benefits and then the non-cardiovascular. First, to date, one major trial, and smaller significant ones, though, show from anywhere from an 18 to 40% less first heart attack or dying from heart disease if you've never had anything happen to you before. We call that primary prevention. So you still, we can actually say you probably get some benefit eating fish or taking fish oil capsules. Patients with very, very high triglycerides, greater than 500, who take high doses of fish oil, can actually drop their levels by about half, 50%. And don't despair, if you're between 200 to 499, you can still decrease your triglycerides by up to 30% taking extra fish oil. People on statins, we referred to this earlier, to lower their bad cholesterol can further improve their numbers, as well as reduce, in one large 18,000 person trial, to prevent cardiovascular disease by adding fish oil to a statin. If you already have heart disease, you actually also get a further benefit. These have been looked at in both cases. The one trial, 80% of people were what we call primary prevention. Nothing ever happened to them before. Patients with, this is recent data, brand new out there, patients with enlarged, weak, and failing hearts, what we call heart failure, but not due to blocked arteries and scar tissue from a heart attack, can improve their heart function by adding fish oil to their already optimized, and I say that again, optimized medical regimen, not in lieu of substitution. The ability for fish oil to lower mild high blood pressure or to aid in helping patients who are already on medications by taking fish oil has actually been established. It's actually been out there. But the overall benefits, I need to say, using fish oil for high blood pressure have not been fully evaluated, nor do we have any. Blood pressure drug. We don't have any guidelines for this yet. Actually, a couple more. While scientists once thought of that fish oil worked, quote unquote worked, by reducing your abnormal heart rhythms, an analysis of about 11 studies, 32,000 people in all, determined a quote unquote neutral effect of fish oil on your heart rhythm overall. That's not to say that doesn't work in certain rhythms we just alluded to in the introduction, but reduction in dying, reducing your dying, must be related, as we said, to some other mechanisms such as stabilizing your arteries, this anti-inflammatory, anti-clot, plaque, et cetera, et cetera, et cetera. How about the non-cardiac benefits? Because, inquiring minds want to know. In the past, small studies showed an increased improvement in patients on antidepressants, which was a big deal. If you added fish oil and you were on an antidepressant, it it reduced the need for more antidepressants and all of that. One recent study, however, in 2009 countered these benefits. But I read further, and the editorial asked not to close the door on this issue. And if you think about it, from my own editorial, stress, and I go back to our lecture on stress in the heart or emotion in the heart, please listen to that one, it's still my favorite. Stress causes inflammation. So why shouldn't fatty acids, which reduce inflammation, improve this? Why shouldn't we take fatty acids if we're stressed out? And Lord knows we all are. There are a number of clinical trials to assess the benefits of fish oil on the inflammatory and autoimmune diseases. These are classified as illnesses where your own body attacks certain other parts using what else? Antibodies. Let's examine a few because these are the important ones. Rheumatoid arthritis. Interest in rheumatoid arthritis and omega-3 fatty acids began in the 1980s, and initial studies using a placebo or sugar pill versus fish oil and another further 13 studies thereafter showed a benefit to adding fish oil to the standard agents with less symptoms, less tender joints, reduction in the number of pain medications, and less morning stiffness at high doses. Inflammatory bowel disease, people might know them as Crohn's disease and ulcerative colitis collectively, where the bowel becomes inflamed genetically and sometimes requires extensive medications and steroids and even surgery. Encouraging results with fish oil out there, folks, shows a reduced rate of relapse, improvement in symptoms, and less use of steroids in some, but not all, of the patients. Asthma is the most common chronic childhood condition, and studies now are looking at using fish oil to predict how effective treatments will be on certain types of asthma, especially in the kids. Something called bronchospasm is being looked at. Now, lastly, for this segment, you may not have heard about the new kid on the block, krill oil. Krill are small shrimp-like red crustaceans that are abundant in the cold, cold Antarctic. And they, because of this, have a high content of polyunsaturated fatty acids, including a lot of DHA and EPA, as well as something called astaxanthin, which is a powerful antioxidant and DNA mender that's found in salmon. Preliminary studies show that krill oil is superior to fish oil in cholesterol lowering, lowers your total cholesterol, your LDL, your triglycerides, and raises up your HDL, your good cholesterol, as well as lowers your blood sugar, improves your arthritis function better than fish oil, and interestingly enough, improves and reduces PMS symptoms in women. More on this one, folks, on smarterheartuniversity.com as it develops. Interesting, huh?
Oh, that's very interesting, especially this krill oil. That's brand new for me. We'll have to see
where
that pans out, because it may be the next level, kind of taking fish oil to the next level.
Exactly.
Going back to the issue of the heart disease stuff, and there's the one most recent trial about fish oil looking at the diet. I don't know if we'll talk about that. That was a negative trial that showed that a dietary intake of only about 400 milligrams showed no change in heart events. But again, and I don't know if the media grabbed this or not, but it gets to, again, there's a lot of studies out there showing a benefit and certainly no harm, and only one trial now with diet only showing a very low dose did nothing. So let's, I think I
go back to that Mediterranean. What I saw was a study that showed that, that if you looked at adding fish oil as part of a Mediterranean diet as opposed to a Western diet, there was a benefit comparing the two. So if you're just using an isolated diet and using a small amount of fish, so that's only going to be about one meal a week of fish, or using only 400 milligrams of that's a quarter of a capsule that's out right now. Okay.
And again, it's one trial compared to all the other trials. And like we talked about in our very first show about the danger of just taking one trial and saying, okay, now the decision's out. And importantly, that trial showed that there may not have been any benefit, but it also didn't show there wasn't any harm. So
again, but there's
plenty.
Don't we want it to do something? Listen,
of course,
it'd be great to take something natural that's going to do some great things. It's not going to hurt us, but it's also going to help us in so many different ways.
And I think there's plenty of data suggesting there's benefits, at least in the heart disease and certainly in the triglycerides at high dosages.
Of course. And again, we're going to, the next topic, next section, we're going to talk about all the common questions. So currently for healthy people, the pop quiz number 2, For healthy people without heart disease, the American Heart Association recommends 500 milligrams, 1,000 milligrams, or 1,500 milligrams of daily EPA and DHA intake, fish oil intake.
I'll go with 1,500.
50 for healthy people, huh? Okay, so we'll be right back on Your Smarter Heart University on AM 970, The Apple. Stay tuned, folks.
More Dr. Scott and Smarter Heart University is on the way on AM 970, The Apple.